A study published in the latest issue of Neurology has found that people with restless leg syndrome have double the risk of stroke and heart disease. The study included nearly 3,500 community-based participants of average age 68 from the Sleep Heart Health Study. The researchers used information provided by participants through detailed questionnaires to establish who had RLS and who had received a diagnosis for angina, myocardial infarction, stroke, or heart failure. This helped researchers determine the presence of coronary artery disease and total cardiovascular disease, which includes reports of stroke or heart failure. The results of this study showed that 6.8% of female and 3.3% of male participants had RLS. People with RLS were found to be 2 times more likely to have cardiovascular or cerebrovascular disease. The link between RLS and heart disease was stronger in people who reported having RLS symptoms at least 16 times per month and in people who reported severe as opposed to bothersome symptoms. Up to 10% of Americans suffer from restless leg syndrome. One of the biggest challenges for people suffering with the condition is the periodic limb movements during sleep, which can cause sleep deprivation that can seriously affect health. Lead author Dr. John Winkelman claims, in particular, people with RLS have as many as 200 to 300 periodic leg movements per night of sleep, and these movements are associated with substantial acute increases in both blood pressure and heart rate, which may, over the long term, produce cardiovascular or cerebrovascular disease.